Birdies. I'm Allie Knight, LPGA and PGA certified golf professional, and I'm here with Dr. Mark, performance expert, and today we're going to talk about burnout. Topic very relatable, and playing and with coaching and all summer long, having a busy schedule. Just by the end, you get to November and I'm ready for a break. Hours of teaching and trying to keep my game and practicing as much as I can. Eventually, it's just like I'm ready for that time off. And I've heard things though that burnout isn't real. The burnout is just a mindset that you can just kind of keep on trotting along, kind of fight through it, and that just change your mindset, because that's not real. So that's why I wanted to talk to you about this today. Just, is that true? Is burnout a real thing?
Yes, hearing someone else devaluing that is not something that as a industry or as a profession that we are very happy about, because burnout is very real. There is an absolute ton of very high quality research showing it's real. One of the most common pathologies that we come across that ends up having, when I practice, the number one reason someone would end up sitting in front of me that in having a very serious clinical depression, sometimes even in a psychiatric hospital because they had tried to hurt themselves or something else, was because of a mindset just like that.
Wow.
That, no, you just have to go through it. No, you don't. You have to treat it.
Wow.
You have to treat it. It is something that's very serious,
Mm-hmm.
or it can become very serious. It's minor initially, which is where we want it to be and where we want to address it. I no longer see patients as a psychiatrist, but it was one of those things that there were oftentimes patients that were sitting in front of me that had gotten the exact same advice, and they could have never been sitting in front of me
Mm.
needing very serious treatments if someone had just said, I understand, and this is something we can address then. So yes, it makes me very happy to hear someone like you asking these types of questions, because they need to be asked, and people need to know that yes, this is real, and yes, this is serious, or at least it can be if we're
Yeah.
not careful.
Right.
Yeah.
Yeah, for sure. So what does the science actually say about it?
So as I said a moment ago, there are quite a few what are called longitudinal and systemic review studies. So these are very high level studies. They don't take a single study and say this is the outcome. They look at a large number of studies and say what's the consistent pattern that we see, right? That's your systemic review. And then it's also, you can also do something if you go on an even larger scale. There's something called a meta-analysis. A systemic review is kind of one step below that. And then longitudinal, just think long, right? So
Okay.
they will have observed elite athletes, they will observe, elite performers for long periods of time. So a lot of studies may only be, say, 6 months, right? Long.
Mm-hmm.
These will have been years. So they could be 5 years, 10 years, 20 years, 30 years. And there's a large number of these very high quality studies that show burnout is what we know as a multi-dimensional syndrome, which, as from a psychiatrist standpoint, laymen can sometimes struggle with this because it's a very high level of nuance. It's a bit like personality disorders. Someone is like, well, it's your personality. Well, yes, but that personality is pathologically abnormal. It's dysfunctional.
Mm.
And so it is also a psychiatric syndrome. Burnout, I'm not equating the two. Burnout is not a personality syndrome. That is not what I'm saying.
Okay.
What I'm saying is they are similar in that they cover multiple dimensions of our personhood, right? So they cover what does that mean, right? They cover the cognitive ability. So our ability to think, to plan, to cognitively process. We talked about cognitive load at one point. Cognitive load is a huge part of burnout. It's another dimension is emotion. So it's an emotional dysregulation. And then the last one is in general a physical exhaustion as well. As you said, you've been going tournament after tournament after tournament, traveling all over the country, all over the world, playing here, playing there, having a high level of physical activity as well as mental activity, as well as emotional activity, and the highs and lows, and all of that's combining, and it's building up and it's building up. And in your case, and we've talked about this ourselves, is you have a mini burnout.
Right.
Where you're not completely burnout, because complete burnout, you are literally on a borderlining cusp going into clinical depression.
Right.
Which is why it's why this is a topic that I don't think is taken seriously enough. Because I would much rather you address it when it's still burnout than have to address it when you are clinically depressed, because there's a whole lot more risk involved there that we can just completely eliminate. That's kind of the evidence from it, both from the science to the psychiatric to the performance. Is there's quite a bit of studies that validate it, show it, and even give us common ways to treat it. And it is a neurobiological dysfunction we can see on functional MRIs and other things, which is a type of brain scan where brain activity from someone who we know shows symptoms of burnout and someone who doesn't, the brain activity of someone with a burnout mimics closer to a brain that has depression.
Wow.
Exactly. So there's not only the literature research, but there are actual scans of brains of people in burnout that are showing that's real. What you feel is real and deserves to be acknowledged and helped.
Wow. So is this mainly does all sports have burnout, or is that more common in golf than other sports?
So great question. Right. So I'm going to actually take your question. I'm going to expand it even farther out just for a moment. Right. Because talking about burnout period as this multidimensional syndrome, as this issue, the burnout can occur anywhere. Right. So, for example, I've had CEOs with burnout. I've had vice presidents. I've had other executives. I've had librarians with burnout. I've had people that are, for example, stay-at-home spouses that have burnout. Raising kids can be difficult. It is its own job. As someone with 2 kids, it's a job. I didn't sign up for this. I joke. I love my kids a little, and so can have some of the highest burnout rates, or some of the highest professions, right, are my own field, psychiatry, neuropsychiatry, very high rate. Some medical fields that deal with more terminal illnesses, for example, cancer physicians, things like that.
Right.
Ministers, very high burnout rate. Dentists have high burnout rates, believe it or not. All of these are very high stressful. Now, if we then, like I said, I wanted to address it as a issue of personhood first, which means it can occur in anyone, anywhere, right? But if we now kind of constrict it down and just say, which is what we deal with, and what I specifically deal with more now than anything else, are athletes, particularly elite level athletes. Burnout can happen across any athletics. However, it does occur higher in elite golfers than it does a number of other sports. There are a couple of different reasons for that. The first one is season, right? So golf season tends to be, I think baseball may be one of the only few that kind of, and I apologize, I don't know quite as much about things like cricket or some other things. Apologize for those of you cricket fans out there. Please educate me. I'd love to learn. The golf season itself is a very, very long season. Matter of fact, I will venture to say it is longer than baseball. Baseball, they report in end of February, early March to spring training. golf's already started by January. It's already doing its Florida or California swing
Yep.
or some
Yep.
other one.
Yeah.
The abnormally long activity, but then golf itself has some unique traits, right? So golf is a sport that has a high cognitive load. It has a high kind of physical stress. Is it the same as running track and marathons? No, but it's a track and marathons are over after a few after a few minutes. Golf lasts several hours.
Right.
So it is a consistent, it's a high stress situation for longer periods of time. So this longer period of time for all of these things make golfers, particularly elite golfers, those that either are playing like on LPGA level like yourself, or have aspirations, or are on a collegiate level or something like that, higher rates of burnout for golfers than a lot of other athletes.
Yeah.
Is what we see.
Okay. Yeah. Yeah, and I definitely see it a lot too, like in my teaching and just from playing golf my whole life, even as a kid, for young kids burning out. They start so young and they might be this
Superstar. Yeah.
superstar as a 9-year-old, and the parent pushes them so much
Yeah.
that by the time they're in high school, they've burned out and they don't want to play golf anymore and they're done. And it's sad to see. So how does, as a coach, what are the signs that we could be looking for so this doesn't, if I'm teaching a kid, to be able to know, like, hey, watch out, this kid looking like he might be
Yeah.
burning out.
So great, again, great question. I want to address that question by first, kind of like I did previously. Let's start from kind of an overarching, and then kind of narrow down a little bit, and then get to the specifics of what to look for. But I think the overarch might help you understand what you're looking for, right? So when you think of, whether it's youngsters or whether it's high level elite athletes, or whatever, right? You have this combination of high cognitive load that I just talked about, a high demand of precision, and a high amount of decision making and stress and performance. These all equal burnout, right? So you have these kids that are having a lot of mental fatigue, a lot of cumulative stress, which then starts to show that all this kind of equals a high burnout type of rate. So what to look for is kind of like the what we know as sequelae to this type of an environment, right? So the first thing is you're going to see is the exhaustion, right? There's a physical exhaustion, a mental exhaustion, an emotional exhaustion. All three may be present in golf. It might be more likely that physical exhaustion is lesser, but mental and emotional are still high.
Mhm.
The next thing would be is it reduced accomplishment. What this means is, and I think when we've talked before, the way I've described it is, if someone would have come to me as a psychiatrist, or even comes to me now, and they say, oh, well, I was really sad yesterday, right? Not getting my script out and writing them antidepressants.
Right.
They had a bad day.
Mm-hmm.
Okay. If someone came to me and said, I have not had a good day in 3 months, yes, right? So when I say reduced accomplishment, I don't mean they had a bad tournament, or they had a bad game, or they had a bad round. I mean, you see a very steady decline of performance.
Mm-hmm.
They went from consistently being ranked maybe somewhere in the top 20 to 50 to all of a sudden, for 10 tournaments, they can't break into the 100.
Mm-hmm.
Right? And they've had this longevity of these high stress environments, right?
Mm-hmm.
And then the last one is going to be, and this one is part of what we know, and shows that it's on a borderline between depression.
Mm-hmm.
In depression, one of the symptoms that we see is your sleep gets disrupted very heavily.
Mhm.
You can have high irritability,
Okay.
right? And then you have increased injury rates, right?
Mhm.
Several of those are things that I would also look for in someone that's depressed,
Okay.
right? Sleep disruption, it could be they require far more sleep than normal. They could require far less. They can't sleep, right?
Right.
So oftentimes eating patterns might change as well,
Hmm.
right? So you'll see these changes, and that's going to be part of your cue of, hey, I need to probably check in with this player, if nothing
Okay.
else, and have a very frank conversation. I always, when I start to see any of those, and you and I have even had some check-ins where I've said, "Hey,
Mhm.
Allie, don't don't sugarcoat it. Tell me the truth. How you doing?"
Right.
Right?
Right.
And there have been times that you've said, "Doing fine. Just feel tired." Right?
Right.
And there's been times where it's a, I'm feeling it.
Yeah.
Right?
Definitely.
And both of those are okay. Right?
Mhm.
And so that's what a coach needs to make sure of is when you have a check-in,
Right.
it doesn't matter what they say.
Mhm.
It's all okay.
Mhm.
It's you're expressing your concern and giving them a someone that they can be very open and honest and approaching about is actually one of the best things you can do for burnout.
Okay.
They know they can come to you and say, I'm feeling
Right.
a little more stressed than normal. I'm
Mhm.
not valuing. I used to love to come practice and hit the range. I couldn't get here quick enough. And for 2 months now, I've had to drag myself here.
Right.
Okay,
Mhm.
let's take a look at that. Let's understand that.
Mhm.
Because as a coach, you can now run some interference for them
Mhm.
and help their burnout
Mhm.
before it gets too high.
Right. But can you measure it? Is there a
You
way to actually measure it?
you can. So there are specifically there's some psychometrics that we can do. So for example, one of them is called the athlete burnout questionnaire that we will use to evaluate. That's going to evaluate probably honestly more from a clinical standpoint than necessarily a coach,
Mhm.
right? Doesn't mean coaches can't use it. It just means that probably better to bring someone like myself in to do
Mhm.
that because it also would be good to separate that evaluation from the coaching relationship that it can be used.
Okay.
That's one. There are other evaluations. Again, people like myself, we are trained to know, and having seen so many number of people with it, I can I can identify almost as quickly or more than a questionnaire. A small digression is I had a pediatrician when I was in med school that he literally could walk into the room, and as he walked in the room, patient never had to say a word, parent had never say a word. He said, "You have this." 99% of the time, he was right.
Wow.
He had just seen so many things he just knew. Coaches, instructors, players like yourself, you know probably more than
Yeah.
you realize.
Right.
Sometimes it
Mhm.
just feels a little taboo to address it. But
Mhm.
the best thing we can do is address it, which is why sometimes it helps to have someone like me because
Mhm.
I'm far more free to address it and not put strain on a coaching relationship.
Right. Yeah.
Yeah.
Yeah. And I know for me, when I'm starting to feel that burning out coming on, it seems like it's always been I'm just take time off. I try to take a break, take a step away, go do other things. And it seems like it works, but what are the things to do to treat someone that starts to feeling burning out?
So one of the things is exactly what you name, right? So there are what we call the cardinal four pillars. For me, I have five pillars, right? I
Mhm.
think there's one that's missed more
Mhm.
often than not. The first one would be exactly kind of what you're doing or what you're saying, which is what's called workload management, right? So there's what is known as a periodization,
Mhm.
or there's a period that's kind of almost it's another term that you can use is probably a better term like that for me that's a more clinical term. I'm comfortable with it, but forced rest. You know,
Okay.
you
Yeah.
are going you may go kicking and screaming, But the coach says, I'm not playing you in the next 3 tournaments. I don't care
Right.
if you want to play. You have to rest.
Mhm.
This is so that you can go to the national championship. I'm not worried about this local tournament, right?
Right.
And so it's kind of this forced rest, or you design specific periods of activity. That's the periodization.
Okay.
You
Okay.
manage the periods, right?
Mhm.
So then the next pillars would be there needs to be some type of, particularly if you see and identify burnout, there needs to be some type of a psychological intervention. Depending on the level of it, it may be they just need a mental health professional. It
Mhm.
may be something a coach can address. Like I said, just having an open relationship, to be, you're safe to talk about what you need to talk about. You're safe to not be okay for a day.
Mhm.
No one's going to force you. No one's going to judge you. Just it's okay. I'm not just here to work on your swing. I'm here to honor and value you as a person,
Mhm.
and that includes all your feelings
Okay.
as well. And some people seem to think, oh, that's such a wishy-washy type. No, 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 no. Like this isn't about wishy-washy.
Mhm.
This is about simply validating a human being who's having feelings and thoughts and experiences they're struggling with, which is something every human being on the planet has.
Mhm.
And tough love can be applied at times. There's also times where you have to have accepting love, right?
Mhm.
Making sure that they know they have that approachable or have that access to, if I need help, I can ask for it, is actually an enormously valuable resource for them. All right.
Mhm.
So that's kind of the second pillar. The third pillar is there does need to be some what I term kind of organizational changes. So so their scheduling, their level of their expectation level, a number of those things need to change. Right.
Mhm.
So for that, I'll give an example. My daughter, she plays in competitive tournaments and things,
Mhm.
and I will notice certain times after a period of time where she's starting to exhibit just a tinge of it. So I will purposely basically say, okay, you're going to go up on the first tee and you're going to aim to the woods, hit the ball in the woods,
Mhm.
because I want you to set up front. This tournament doesn't matter.
Right.
And you just play a round of golf
Mhm.
and you enjoy that play for what it is, which is a game and play and
Mhm.
doing something. We're just out here having a fun day.
Right.
I might be caddying
Yes.
for, right?
Mhm.
And so take one, and I do that with a tournament specifically. I'm not going to do this at a national championship, right? I'm not
Right.
going to do this at a state tournament. I'm going to do this at some tournament that it doesn't really matter, right?
Yeah.
So yes, there is strategy in place there, but as someone who kind of helped coaches her a little bit, it's more of I want you to take what would or should be a high stress environment, and I want you to purposely make it into a no stress environment to tell your brain I don't have to always put this as a life or death situation, right?
Mhm.
Final one is, and this is specifically for athletes such as yourself, high elite athletes, whether again you're collegiate or you're professional, got your card, you're trying to get your card, you're trying to go from Epson to LPGA, or whether it's the Corn Ferry to the PGA or whatever it is. So
Mhm.
high athletes. So you should have what I term multi a multi-dimensional integrated care, right? So
Mhm.
you should have, for example, a sports psychologist that you can discuss things with. In my case, I'm unique where I'm both a psychologist from as training as well, and I'm a medical physician. So but you should also have medical care, right?
Okay.
You should have someone that helps you with a sleep issue. You should basically have a team around you that's helping you both prevent burnout and treat and deal with your burnout. The
Okay.
the final pillar, my fifth pillar, which I actually think is one of the most important pillars,
Mhm.
is as a coach or an instructor, prevent it from ever happening in the first place.
Right. Mhm.
So all of these things that we do to treat it, you can already implement in some form, some lighter form which
Right.
means less stress for you, less stress for them,
Mhm.
less obligation all around, less schedule disruption.
Mhm.
You could already implement different types of these all along the pathway
Mhm. Yeah.
and have a much greater success at preventing burnout from ever happening.
Right.
Right. So, if it's okay, I'll use you as an example. Right.
Mhm.
So if rather than you getting all the way to October, November, and then sitting down having a cup of coffee with me and saying, Dr. Mark, I'm over it. I'm so over it. Right. What if I checked in April or May and we sat down for that cup of coffee and I said, Allie, how's it going?
Mhm.
Well, it's pretty good, ups and downs, I've been traveling a lot. Well, how's traveling? How's the family? And we just have a check-in. You
Mhm.
might, and I'm making this completely up just for hypotheticals, but
Mhm.
you may say, well, I have this struggle or I have that struggle, and well, okay, so how is that affecting your game?
Right. Mhm.
How have you dealt with that
Mhm.
so that it's not affecting your game?
Mhm.
As opposed to you're dealing with these personal struggles. Now your game then struggles. Now you're having the flights got disrupted and missing this, you're doing this, you're doing that. You have a chance to head it off before it ever happens.
Mhm. And I think that's probably the most important part. If you can just catch it before it happens, that's probably the most important step, I would say.
Absolutely.
Yeah.
Which is why I say for me it's 5 pillars, and I actually
Mhm.
think that is the most important pillar.
Yeah, for sure.
Because it is that old saying, maxime, an ounce of prevention.
Right.
And again, there's a reason there's high stress. There's a reason you're elite. You're the
Mhm.
1%,
Mhm.
right? It's not about taking the stress away. It's about giving you blocks where your mind, cognitive load, stress level, physical, everything has a moment to just relax
Mhm.
so that it can rejuvenate and perform as well or better in the next one,
Mhm.
which is why I think that prevention is so vital.
Yeah. Yeah, and it sounds like as a coach, the check-ins are very important to kind of keep an eye on your students, and that's
Well, and having if there's any way at all, one of the reasons I do what I do is there's not as much access as I would personally like to see collegiate athletes, elite athletes like yourself, to individuals like myself where, hey, you walk into my office and you close the door, or we jump up on a Zoom call or whatever it is, and you have a professional. You can tell me anything you want. I'm ethically and legally obligated to keep it to myself. You have a space where you can, and I have had this before, where a client has screamed for an hour
mhm.
and then got up and said, that was the best session I ever had. Thank you. I said, you're welcome. That's my job. And she did. She went off and boom, she killed it. She just needed a space to let out all of her angst. But having a coach that is, and the check-ins are not just emotional check-ins or game check-ins, but how you sleeping,
Right.
right? Because remember those core symptoms.
Yeah.
So you're checking those symptoms in occasionally so that you're keeping a litmus, because you may very well see it. I'm guessing that if, for example, that if I took yourself and maybe 10 other golfers that you run the tour and stuff with, and I basically put you in a study and forced you to have check-ins, right?
Mhm.
I'd be willing to bet I would pick the symptoms up from those check-ins long before even you would,
Mhm.
right?
Probably.
So
Yeah.
that's one of the reasons those are so important, particularly for coaches of teams.
Yeah. Yeah.
Uh,
For sure.
to have those and set them as a priority.
Mhm.
If you want to win, do what you need to do along the way to do it, and that, in my both professional and the scientific literature says, my professional opinion and the literature says, that's how you do
Mhm.
it. Yeah.
Right. Yeah. So really the big key takeaway is burnout it isn't inevitable. It's preventable.
Absolutely.
Yeah.
And then when you do see it, the quicker you address it, the better the outcome is going to be. My plea to coaches, instructors, players, everyone out there, what you're feeling is normal for what you do. There's neurobiological reasons that you feel that. Your systems, your brain systems, for example, for attention, for emotional regulation, for cognitive functioning, they are in hyperdrive. And it is inevitable that they get exhausted.
Yeah.
So reach out. If someone isn't reaching out to you, reach out to someone. That's come to my page if you need to, and make the free initial consult, and I'll talk to you however long you need to talk. For the coaches, pay attention to your players.
Right.
Because I also know for coaching, I've coached myself. I've dealt with a lot of other coaches. ROI is important, right? Yeah, I'll be the first one to tell you, yes, it is. If you want your ROI, you have to I. Right? If you want your return on investment, you have to invest.
Right.
Right?
Yeah.
I can invest in a company that loses money, and it's a poor investment. I can invest all my time into demanding how people are performing and giving them tough love and telling them this and telling them that and putting more and more stress on them, and your return is going to be crap.
Yeah.
As opposed to if I do the right investment of check-ins, making sure my team dynamics are healthy, making sure that I balance that tough coaching love with also an accessibility, and your return is going to be significantly higher.
Yeah.
And it doesn't always feel that way. Even the research shows it is.
Yeah. Yeah. Well, thanks so much. This is such a big topic, especially in the golf industry and even other golf professionals, country clubs and things. It's a
High
high
stress.
turnover. I
Yeah.
know a lot of assistant pros that end
Yeah.
up going back out of the golf industry just because of the high hours and workload during the peak season. So it's definitely a very relatable subject that comes along with the golf world.
Absolutely. And again, I will kind of repeat my plea for those club pros. If you're starting to feel that, find someone like myself. It may be because I know a few of those myself where they got out of it and their access to get back in it was gone, and they always regretted it.
Right.
When if they had just reached out, we could have helped treat and prevent it.
Yeah.
And they could have been able to continue, even if it was a brief break. We could have made strategic plans to how you have a brief break and go back in it. So it's I just can't emphasize enough for whoever it is, reach out.
Yeah.
Find someone that can help.
For sure.
Yeah.
Okay. Well, thanks so much, everybody. This is Brains and Birdies. I hope you enjoyed it. Make sure to like and subscribe our channel to hear more.
See you next time.